Have you ever had a medical question and just didn't want to ask your doctor? Have you ever been too embarrassed to talk to your doctor about bowel movements? Are you even aware of what a bowel movement is? This information might help you catch a medical condition that could help save your life. As someone who watched their sister fight for her life at the age of 21 from a manageable disease because she and the doctors at a local hospital didn't understand the importance of her symptoms, I've become very concerned about helping others understand ulcerative colitis. The disease ulcerative colitis has no known causes, so being aware of the symptoms and knowing when to seek medical help is very important. To fully understand this disease, you have to know 4 things. What is ulcerative colitis? What are the symptoms? How is it diagnosed? And what are the treatments? Ulcerative colitis is one of the 2 main forms of IBD, or inflammatory bowel disease, not to be confused with IBS, which is irritable bowel syndrome. Ulcerative colitis is an autoimmune disease where the body attacks parts of or the entire colon. The effects on the colon can be as little as inflammation causing discomfort to ulcers and perforations of the colon. It can also lead to a higher risk of colon cancer. The symptoms of ulcerative colitis differ by the severity of the disease and can be easily mistaken for other conditions like your body handling stress or even morning sickness. The common symptoms include diarrhea, abdominal pain, or abdominal cramps, the inability to move bowels in spite of the urge to go, and unintentional weight loss. Severe symptoms of ulcerative colitis include significant weight loss, rectal bleeding, severe pain, diarrhea, dehydration, and shock. When colitis is in its rare form, fulminant colitis, patients can undergo life-threatening symptoms, which include colon rupture and megacolon. My sister is one of the few that experienced fulminant colitis and was hours away from death when she finally got to a doctor who knew what to look for. Some cases of fulminant colitis do end in death because of the complications of having a ruptured colon. When a person suspects they may have ulcerative colitis, a doctor will then look to rule out other causes for the symptoms before giving the diagnosis. When a patient meets with the doctor about these conditions, the doctor will get a brief history of the symptoms and question them about their health and their family health history. The testing process can include blood tests, stool samples, x-rays, CT scans, and even a colonoscopy. When ulcerative colitis is an incurable but manageable disease, there are many medications available for somebody living with ulcerative colitis. The medications your doctor decides can be anywhere from over-the-counter medications to help deal with the symptoms to anti-inflammatory medications to immune suppressors. When a patient has a severe case that is not caught right away, or if the patient has tried all other treatments, surgery may be the option. A patient who undergoes surgery for ulcerative colitis may have some or the entire colon removed and may need a temporary ileostomy. Within recent years, a surgical outbreak was made that allows somebody who has had their colon removed to have a procedure done that makes a pouch out of a section of small intestine to give patients a more normal life versus living with the ileostomy, where a section of your small intestine is brought through an opening in your abdomen and then waste is collected and disposed of from a bag. Rising numbers of IBD and IBS are something to be aware of. We need to understand the importance of our health and to break the barrier that is up about not discussing bowel movements to our doctors. You never know when it could help save your life. I give you this knowledge to go forward and make bathroom talk important and not just something we flush away like it never happened. Today I leave you with this information in hopes that you will at least understand the importance of knowing the symptoms and the importance of being aware of your own health.